My name's Amanda Mahoney, and my presentation is going to be on the wonderful world of psychodynamic therapy. I will be talking about the things I found most valuable, along with 2 case studies to demonstrate the literature. Although I know many hold the belief that Freudian views are outdated, and I strongly agree with that. However, I also strongly believe that these theories set such a strong basis for everything we do as therapists. So first, I want to look at why. Why did I choose psychodynamic therapy, and why am I so drawn to it? So first, I want to talk about my aligned beliefs with psychodynamic therapy. First, the belief that reality is constructed is one that I also hold. So this is the idea that we are born with a blank slate, and that through our environment and our personal experiences, our personality is formed. Next, our childhood experiences and unresolved trauma shape our behavior. Last, the past is the key to our own self-awareness. So, in summary, everything that we have experienced in the past is going to affect us in the here and now. The second thing that drew me to psychodynamic therapy is the population effectiveness and who it can treat. So, anxiety, depression, personality disorders, trauma disorders, and panic disorders. All things I am very, very interested in. And the last thing, the variations of psychodynamic therapy are super appealing to me because there are so many different ones: psychoanalysis, object relations, self-psychology, brief psychodynamic therapy. And with all these tools in our toolbox, I think it's a efficient way to approach some of our clients. So next, I'm going to be talking about the techniques that I found most noteworthy. So although I know that there are many other techniques such as free association, interpretation, I'm going to be talking and focusing on some deeper, more specific ones. So the first, transference. This is the idea that the client is going to take their past feelings or the unresolved issues with a primary caretaker and take those characteristics and project them onto the therapist. This can create something really cool called a corrective emotional experience. So, this is when the therapist is going to respond differently to the client. And so instead of the client just thinking that when the therapist is quiet, they're judging them, the therapist is going to acknowledge it and say, no, I'm not judging you. I'm actually just thinking and taking everything in. And this causes a correction in the feeling and the emotion that the client is experiencing. And that's awesome. Next, contingency control. So this is when we're going to take a problem and we're going to exaggerate it to make it humorous. Next, fostering a safe environment. If the client does not feel safe, trauma is not going to be able to work through, anxiety is not going to be able to work through, anything emotionally taxing is really not going to be able to be dealt with because they need to feel safe first and foremost. The last thing that I found super noteworthy was reality testing. So this is going to come in handy with personality disorders. So it's going to sound something like this. You tell me that you hear voices in your head. Okay, did you see them? So first, I'm going to jump into my first case study. So, psychodynamic therapy with adolescents with depression. So first, I want to highlight a super concerning statistic that 23% of adolescents aged 12 to 15 have a prognosis of lifelong depression. That's no good. So what can we do about it? Lavorgin in all in 2019 produced some research that supported the psychodynamic theory worked just as much for adolescents as it did for adults with major depressive disorder. So not only did they look at the effectiveness, they looked at what was effective. So using a qualitative intensive review process of 9 different reviews, the participants were asked to identify why and what their therapy was doing for them. So they found 4 consistent themes in this research. First, they found the exploration of self with therapist was super beneficial. A very powerful quote that I pulled from the literature said, "It helped me take action and speak up. It gave me insight and acceptance of myself." This is crucial, especially in the adolescence age. Second, relationship with therapist and their character. So trust and confidence is going to be key here. Next is a focus on everyday life. Clients reported that they were able to take what they learned from therapy and to incorporate it in their everyday life. And the last thing was time factors. They appreciated the frequency and the duration and proved it to be optimal for them. So why is this significant? What is psychodynamic therapy doing for the youth? This is what I have to say about that. A common theme reported is that the therapist asked questions that allowed clients to open up, and this led to clients feeling less alone. And one adolescent even reported feeling a decrease in suicidal thoughts and anxiety, as well as a strong decrease in panic disorders. So another participant claimed that although she didn't even want to come to therapy, she ended up feeling that it was the most supported place that she's ever felt, which is really powerful. So next, I'm going to be looking at psychodynamic therapy and borderline personality disorder. So 1 to 2% of teenagers are going to experience some of these symptoms, but I'm not going to say diagnosed because there's some controversy over that. So there are 2 empirically based theories that are effective with these symptoms. First, mentalization-based treatment, which is going to help clients discriminate between what people think and what they think people think. So it's going to teach people metacognition, teaching people how to think about what they're thinking about. The second is going to be transference-focused psychotherapy. So this is going to help clients create a positive self-regard and identify problematic behaviors and assumes transference is normal. So we have 2 outcomes of this. We're going to have reflective functioning, which is going to be the ability to reflect on everything, your feelings, your wishes, your goals, your mental states, and this is key for BPD. The next thing that we're going to get out of this is personality organization. So this is going to help with our internal object relations, and it's going to help us with organize our inner world. So the goal of BPD and psychodynamic therapy is to expand mental and psychological functions and thoughts to diminish these symptoms. And this was studied both in 1999 and 2001. So the last things I'm going to talk about is the caution that we need to have with multiculturalism and psychodynamic therapy. So there is this preconceived idea that therapy and treatments are all universal. We know now that that's no good. So notable considerations or interpretations. It is crucial to be sensitive to interpreting other cultures. And really we want to try to stray away from that. And next is the exploration of early childhood. We may need to further explain this to the client because they may not understand why we're going back so far. So as seen in a case study, we have a African American male named Dupree who is 26, who is seeking therapy for a spiritual crisis. And his therapist is a white male. So there are interventions that he found effective, and these include his technique and his focus. He thought the therapist was non-judgmental and had a good amount of self-disclosure. However, there were some severely ineffective interventions with psychodynamic therapy. It disregarded any social and cultural environments, and we know now that social environments are crucial to our behavior and our well-being. And also body language. There is too much eye contact and too much close proximity that made Dupree feel uncomfortable. And this is something we need to be highly sensitive to and highly aware. So the last thing that I want to leave you guys with are 3 major takeaways. 1, psychodynamic therapy is not for everybody, and it's not just a general approach. So it is very efficient for some and not for others. The goal is to change aspects of identity or personality, or to integrate key developmental learning missed while the client was stuck at an earlier age of emotional development. And lastly, psychodynamic therapy is aimed to change personality and promote life changes. It is focused less on specifics and more on the person as a whole. Thank you.